Good evening, everyone, and thank you for joining our Men's Health webinar. We'll start with a few housekeeping items, and then I'll introduce tonight's speaker. First, your participation in tonight's webinar is completely anonymous to other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speaker. If you wish to ask a question, please type it in the chat box at the lower part of your screen, and we will have a Q&A portion at the end of the presentation to address these questions. Our presentation tonight will last for approximately 1 hour and will be presented by Dr. Alex Tatem of Urology of Indiana. Dr. Tatem graduated from the University of Georgia in Athens, Georgia with his BS degree in biochemistry and molecular biology, followed by his medical degree from the Medical College of Georgia in Augusta, Georgia. Then he completed his internship in general surgery, followed by his residency in urology at Indiana University in Indianapolis, Indiana. Lastly, completing a fellowship in male fertility, microsurgery, and sexual medicine at Baylor College of Medicine in Houston, Texas. Thank you for joining us tonight, and now I'll turn it over to Dr. Tatem to get us started.
Hey, everybody. I just want to personally thank each one of you for tuning in. I know it can be really hard to talk, well, really to go to the doctor for anything, but much less whenever you're trying to learn about these very personal issues that we treat in the realm of men's health. So that's why I'm so glad that we have opportunities like this, like a webinar, where you can actually learn more about these really sensitive issues, while at the same time maintain the comfort of your own home. But please remember, this is all about you. So if you have any questions tonight, please do not hesitate. Type them in the chat. Amy's going to help me out as far as organizing them. We're going to answer each and every one of your questions at the end of today's presentation. And so I look forward to engaging with you and talking about some of the cures that we have in men's health. So starting off, this is me. So Alex Tatem, one of the men's health physicians at Urology of Indiana. I'm primarily located at our Nab Road office and also in our Greenwood office. And I've gone to some other offices as time allows. As a specialist, they love to pull me in different directions all at once to try and make sure that we're reaching guys wherever they're at. But that's where my main locations are. So let's talk about erectile dysfunction. So erectile dysfunction is a extremely common issue in men's health that nobody wants to talk about. And the unfortunate truth is that it's actually more common than what most people would believe. But because of the stigma that surrounds it, guys just don't want to engage. They don't want to talk to their doctor about it. It's something that is very hard for them to bring up. And unfortunately, most doctors don't do that good a job when it comes to actually addressing it. So it's my goal to try and dispel a lot of that stigma around erectile dysfunction and give you guys some solid educational information and hopefully provide some answers and some options. So starting off, what is erectile dysfunction from a technical standpoint? It's the persistent inability to achieve or maintain an erection firm enough for intercourse. It's more prevalent, like I said, than what most people would believe. It's going to be up to 50% of men over the age of 40. I'll often joke with my patients that if you develop erectile dysfunction, in a way you're kind of lucky because it means you've lived long enough to get it. The truth is that if you make it out of this world without erectile dysfunction, it means you got hit by a bus. So truthfully, I think that this is something that every guy is going to have to deal with at some point in their life. And so that's why I think it's so important that we discuss it, tonight. So at the end of the day, the erection process is fairly simple. I tell guys that your erections are just two inflatable tubes that start in your pelvis and go throughout the shaft of your penis. And what happens is that whenever you're aroused, you get a rush of blood into those two inflatable cylinders, and they become firm and rigid. This is separate from sensation, orgasm, ejaculation. As guys, we think those are all the same things when it's really not true. Erection is kind of its own isolated thing. And that's what fails as you get older. And the thing is that when that happens, it has a really broad negative quality of life effect on men. It causes severe issues with self-image, with relationships, and it can actually cause other health issues as guys just feel really down on themselves, and it's harder to keep up other aspects of their health care. It's been shown that men with diabetes that have erectile dysfunction have a harder time controlling their blood sugars. Okay, this is a very significant self-image problem for men. It's a medical issue and deserves to be addressed. Now, we're talking about the different causes. The vast majority of causes are all medical. If you see here, the old paradigm of thinking that well, it's just in your head. Or unfortunately, what maybe a lot of partners think with their spouses, oh, it's just in his head, he's not attracted to me anymore. It could be further from the truth. Okay, erectile dysfunction is a medical disease like high blood pressure, diabetes, cardiac disease. This is something that is a consequence of things going wrong. Okay, it's not that someone isn't interested in somebody else. It's the fact that they don't have adequate blood supply where they need it most. Okay, most common causes they have listed here, or at least what I see in my clinic, is high blood pressure, cardiac disease, diabetes, but also treatment for prostate cancer, which we're going to talk about more a little bit later. ED and diabetes come hand in hand. If you have diabetes, it's not if you're going to get erectile dysfunction, it's a matter of when. And we know that men that have diabetes and ED are going to require more significant treatments for their erectile dysfunction, and they're going to be less responsive to the options that I think we're most familiar with, like Viagra and Cialis. Okay. Getting back to what causes this, okay, why is this such an issue? Comes down to plumbing. I tell guys, this is a plumbing problem, this is a hydraulic problem. At the end of the day, the blood vessels that supply your penis are about 1/3 to 1/4 the size of the blood vessels in your heart or in your head. This means that as a guy, you can have perfect cardiac health, perfect neurologic health. You haven't had any sort of other vascular disease, but you can have profound erectile dysfunction. And so whenever I meet men and they often tell me, oh, well, I had some, how long have you had erectile dysfunction? Maybe a year or two. Do you have any other medical issues? Oh, well, I had, my heart worked on, I had to get some stents, about a year ago. And then you question men a little bit more, and it turns out maybe they started having just some difficulties with their erections a while before that. So that's why it's so important to discuss erectile dysfunction, because it can be a precursor, sort of the canary in the coal mine, if you will, about other medical issues. So, all right, let's talk about the effect of prostate cancer treatment on erectile dysfunction. Whenever we are looking at things like prostate cancer or prostate removal, okay, sometimes some other big pelvic surgeries, bladder removal is very similar in men. We end up having to talk about the anatomy of the pelvis, okay? The nerves, the electrical wiring that tells the body to turn on the switch to improve blood flow to the penis, those require an intact signal from the brain all the way down to the penis. And these nerves are densely attached to the prostate. So anytime that you have the prostate treated or removed, okay, for prostate cancer, then you're gonna have difficulties achieving erections afterwards. And these men often aren't responsive to some of the easier treatments like Viagra and Cialis. Now, if we look at this, something that I think is a misnomer is a lot of men think that radiation is a way to avoid erectile dysfunction when it comes to prostate cancer treatment. Unfortunately, that's not true. It's actually about equivalent to prostate removal. It just happens in a little bit more of a delayed fashion. So again, prostate cancer does not cause erectile dysfunction, but prostate cancer treatment does. That doesn't mean that you should not go get treated. You absolutely should. Prostate cancer is one of the most curable diseases that we have in urology, but we need to be cognizant about some of the quality of life effects that can happen later down the line. We also need to talk about Peyronie's disease, okay? So we talked about those two inflatable tubes. Well, the truth is that a lot of men can actually develop scarring inside the penis related to maybe an injury, poor quality erections, putting stress on the penis, and they can develop scar tissue that hooks and curves the penis. This feels like a bump or a nodule and is often accompanied with erectile dysfunction. So not only can you not achieve a firm enough erection for intercourse, but the penis can be abnormally curved, making intercourse difficult or even impossible. This is another specialty of mine. Now, let's talk about our treatment options. When it comes to treating erectile dysfunction and Peyronie's disease, we actually have more treatment options than we've ever had before. The first are the most common, the oral medications like Viagra and Cialis. I think most men have heard of these and many more have tried them. The truth is that it's great that we have these. They work fantastic for men with mild erectile dysfunction. But the unfortunate reality is that they are not a silver bullet. They actually have significant side effects. They can cause headaches, flushing, stuffy nose, that sort of thing. And they can also cause issues with men that are taking other medication like nitrates, okay? If you look at the likelihood that they're gonna work for you, okay, it's actually close to a coin flip. About 15 to 50% of men that try oral medication for erectile dysfunction will actually not respond to it, okay? So it's important to have these medications, it's important to try them, but we need to understand their limitations. Now, another device or another option that many men have heard of is a vacuum erection device, okay? Also known very colloquially as a penis pump. This is a device that manually pulls blood into the erection into the penis to facilitate an erection. It can work, and it can allow you to achieve an erection. But the challenge is that as soon as you remove the device, okay, you can get an immediate loss of the erection, and it can be a little uncomfortable to use. If you think about it, it's not the most spontaneous thing in the world. You have to excuse yourself for a moment, go to the closet, get the device, apply the lubricant, get it to seal with the skin, pull the blood into the penis, and then you have to put a tight constrictive rubber band at the base of the penis. That can block ejaculation, and truthfully, it actually cuts off all blood flow to the penis. So you can really only use this for 30 minutes at a time. Also, practically speaking, the erection tends to be very floppy and unstable, which is not satisfying to a lot of guys. So what other options do we have? Well, we can actually take a similar medication to what's in the pills, and we have that in what's called a urethral suppository. So it's a pill that's actually inserted into the tip of the penis. It's called Muse. Muse is more effective than Viagra or Cialis, but I can tell you that as someone who treats thousands of men, okay, with erectile dysfunction, I do not have a single patient using Muse regularly. And the reason being is that it is just a real pain to use. It burns like fire, and it tends to be very hit or miss as far as efficacy. It's also gotten prohibitively expensive lately. And so it's hard for that to be a long-term option for guys. I used to see it used more often in the VA system because it was covered there for a while. But out here, kind of in the real world, it's not covered, it's expensive. And even for those gentlemen that it was covered, it was still very inconvenient. So then we move on to injections. And I think that's something that most people have maybe heard of. You've heard it advertised by different, men's health clinics, which is a totally different conversation. But this is an injection of medicine that is similar to Viagra or Cialis, but much more potent. What this does, it allows the maximum dose of medicine right where you need it. And it's introduced through a small needle. It's the same type of needle that you might see used with diabetes, okay? This is a great option, okay, because it allows for a higher dose right where you need it, and it can allow a lot of men to achieve an erection who otherwise weren't able to, okay? But the problem that I have whenever I'm talking to guys is I talk to them about putting a needle in their penis, and I'm afraid they're going to run out of my office as soon as they hear that. That is not something that most guys are excited to do, and it has some challenges. Most men are afraid of the needle itself, but truthfully, if you look at what causes men to stop using it, it comes down to some of the side effects and the convenience of using this medicine. It's got to be in the refrigerator, so that means you have to go get it out along with all your needles and syringes every time you want to use it. You can only use it once every other day, and it can kind of sting and burn a little bit, both when administering the medication and the resulting erection. So intracavernosal injections can also be a challenge, and that's why we know that if I start 5 men on injections right now, only one of them will still be using it a year from now, okay? We would not accept that sort of success rate in any other field of medicine, okay? But what is a definitive cure? What do we have that can offer men a lasting and satisfying solution for their erectile dysfunction? And that comes down to what I call the anatomic issue, okay? So let's just go ahead, and I'll go to the slide before this, and I just want to talk through this concept. So if at the end of the day, your erections are just 2 inflatable tubes, they don't control sensation, ejaculation, or orgasm, and those are broken, what do we need to do? We need to restore function to those tubes, okay? That's a hydraulic system. Think about your knee. If someone has end-stage arthritis and they can't walk, what is your knee? Your knee is a hinge. If you can try pills for your knee, like Tylenol, ibuprofen, you can try steroid injections. But if those don't work, ultimately, what happens? Well, you go see an orthopedist and you get a knee replacement, which is invisible from the outside. Nobody would ever know that you had a knee replacement, even looking at you, okay? But all of a sudden, you have restored that function by going down to the base mechanism. We do the same thing in erectile dysfunction. When you have ED and you are not able to achieve an erection, you have a physical failure, an anatomic failure of 2 inflatable cylinders, okay? It's basic hydraulics. So what we say is, what if we could do a minimally invasive outpatient procedure, often under local anesthesia with a mild sedative, where we actually make an opening in the skin only that big and slide our own inflatable cylinders inside your body's natural ones, the ones that are broken. Then, instead of having to rely on a pill or a shot, we put a small pump at the bottom of the scrotum. It's invisible. Nobody can see that you have anything, but when you squeeze that, it fills those cylinders with saline the same way your body naturally used to fill those cylinders with blood. that can allow men to achieve a firm, satisfying, lasting erection that whenever they want, and it stays however long they want. And that's called the penile implant, okay? And it is universally the most successful and really the most tried and true treatment for erectile dysfunction. And at least in my personal vision, the only cure for ED, because everything else is just a treatment. We're just not really fixing the issue. We're kind of dancing around it, okay? You still have to have those treatments constantly. When you have an implant, you're fixed. You don't have to worry about anything anymore. No matter what happens, you're ready to perform, okay? Patient satisfaction rates are 98%. Partner satisfaction rates are identical. And what's great about the penile implant is that it allows you to stop thinking about your penis and stop thinking about your erections, because you know that that's always going to be there for you, okay? So we're going to move on here. We'll see if this works. I've got this animation, and we're going to try and play it for you just so you can see what the implant looks like in action. So you can see externally, there's nothing you can see, okay? It's completely internal and private. As you squeeze this pump, it moves saline from the reservoir into these two inflatable cylinders. They expand in length and girth, and they allow men to achieve a firm, reliable erection. Externally, you can never tell that the man has had anything done. I have a lot of patients of mine that are still out in the dating world who have a penile implant procedure, and they actually activate it before they're going to be intimate with a new partner in the bathroom. That means that they are actually fully functional, fully sexually active, and nobody knows that they have an implant besides themselves. It's very personal, private, and discreet. So, like I said before, the implant is a permanent, private solution for erectile dysfunction that is more reliable than anything else that we have in our tool bag, okay? Many men have been treated with a penile implant with fantastic results. I know that I personally have done well over 100 implants just in the past couple of months, and my patients are thrilled. I honestly think the only guys that aren't happy with the implant are men that think that it's going to be, how do I put this? They think it's going to be an enlargement procedure, or it's going to make them John Holmes. It's not like that. And the way that I phrase it to men, the way I phrase it to their partners, is that this is a functional surgery. This is designed to give you back what God originally intended for you to have, okay? This is not some enhancement or performance enhancement surgery. I mean, it is, I guess, in one sense, but we're really just trying to give you back what you're supposed to have, okay? The issue of insurance coverage is important. But what I love is the fact that Medicare universally covers the penile implants, okay? It is extremely rare that I ever have a Medicare patient that isn't covered, okay? I can only remember maybe one who had some off-brand Medicare plan. Now, when it comes to private commercial insurance, it can be a little bit more variable, but that is something that we always check before we move forward with anything to make sure that you're covered and that nobody gets a nasty surprise bill in the mail, okay? We don't operate that way. And truthfully, we actually have negotiated what is the most competitive cash price for an implant if it's something that you're interested in and your insurance plan does not cover it. I'm very proud of the hard work we put in to make that possible, okay? Like with any procedure, there are risks with a penile implant, just like any other time you let a doctor touch you. But the thing is that those risks are extremely rare, okay? And I'm more than happy to discuss those with any of you. If you have any personal questions, please make an appointment with me. I would love to talk to you in person, okay? But in summary, ED is an extremely common problem. It has significant, long-lasting personal effects on men and their partners, okay? But we have really amazing treatment options, especially in the form of the penile implant, which is a true permanent cure. And I would encourage any of you that are struggling with that to please reach out to me, okay? Now, let's talk about something else. Let's talk about leakage after prostate cancer. Now, the reason we're talking about this tonight is because a lot of men who have erectile dysfunction have it because they've been treated for prostate cancer, specifically in the form of prostate removal, and they may be leaking some urine, okay? That's something that needs to be discussed, okay? It can be absolutely devastating for a man when he's leaking urine that he can't go outside, play ball with his grandchildren, walk around, enjoy the things he loves to do because he's afraid of leaking urine. And this is something that I think really deserves a conversation, okay? Male stress urinary incontinence is the official word that we give it as doctors, but it's bladder leakage, plain and simple, okay? It can be present in up to half of men that get their prostate removed. I can tell you from practical experience, I treat a lot of men. I actually run our prostate cancer survivorship program at our practice. The incidence is actually much lower than that in modern series, okay? But for that handful of men, it can be a real challenge, okay? Now, if we look at the urinary process, your kidneys make urine by filtering the blood, it's stored in the bladder, and then it gets evacuated and rushed out through the urethra going out the penis. But it has to go through the prostate, and the prostate is very, very close to the muscles that control continence called the sphincter. And the challenge is that sometimes that interface can be damaged during prostate removal. Sometimes it's just related to the nature of the prostate cancer. Sometimes it's related to having the prostate removed and then having to get radiation. But really, it is just an anatomic issue, okay? Now, whenever we talk about the different causes, obviously prostate cancer is number one. There are a handful of different neurologic reasons, but really, 99 times out of 100, when I see a man for urinary leakage, it's gonna be post-prostatectomy, okay? Like we mentioned earlier, urinary incontinence severely affects quality of life, okay? This is absolutely devastating for guys. They just don't see themselves the same way. They have a hard time leaving the house. I was just told by a patient of mine that he had to have his wife bring him new pairs of pants when he was working at the barber shop. He was so embarrassed. He'd have to go change in between treating clients in the back room as he just continued to stuff his wet clothes, his wet pads into the trash can, into various garbage bags. He'd try to take them home without leaking in his car. It's just absolutely devastating. So although that this is not a life or death issue, I really think that the impact on a man's quality of life is right up there. Now, whenever we start talking about the connection of prostate cancer treatment and urinary leakage, I think it's helpful to kind of look at this image again. We looked at this previously with erectile dysfunction, but you can see there on the right side that the sphincter muscle is directly attached to the prostate. So I just think that gives a better anatomic understanding of what's going on, because I think that that's helpful. As a patient, you can't really understand our treatment options for prostate cancer or for leakage after prostate cancer until you understand the anatomy of things, okay? How are things supposed to work, okay? Generally speaking, everybody tends to leak after their prostate removal, but it will get better with time. But in a small subset of men, it doesn't, and that's why we have treatment options for urinary leakage, okay? We have a lot of what are called coping mechanisms. Coping mechanisms are not treatment options, okay? Wearing a pad, wearing a condom catheter is not a long-term treatment strategy, and it's really not viable for a lot of guys. These are all things that I think are worth trying in our prostate cancer survivorship program. We really encourage pelvic floor physical therapy. I think that's extremely beneficial. But once you've reached 6 months, okay, post-prostatectomy, you should be dry. If you are further out than 6 months and you are still leaking on yourself, you deserve a more definitive treatment option, okay? These short-term treatment options, if you want to call them that, are expensive and inconvenient. Depends are expensive. You burn through them like kindling, and a lot of times they are not covered by insurance, okay? Now, what are our treatment options? We really have two, okay? And they're both designed to support the urethra, which is the urine tube that urine travels through as it exits the bladder and goes throughout the tip of the penis, okay? The first one is the male sling, okay? This is designed to support the urethra. We also have the artificial urinary sphincter. This is something that's designed to replicate the natural function of that sphincter muscle. These are not, one versus the other. These are two different treatment options for two different types of men. But we're going to get into it, okay? So the male sling, I love this surgery. I think it's a great option. This is really good for guys that are only leaking a couple of pads per day. They can kind of start and stop their stream, but their sphincter just isn't strong enough in order to completely hold their urine when they lift heavy things and move around, okay? And what's nice is that this doesn't require any thinking on a guy's part. It's just constantly working all the time, okay? This is a minimally invasive outpatient procedure that I do through an opening in the skin. Again, very small. I'm a big fan of my small incisions. Patients heal faster. They are confident. They don't have to worry about being laid up. I think a lot of guys are afraid that what I do to them is going to be the equivalent to what they had maybe when their prostate was removed. And truthfully, it's nothing like that at all, okay? Now, the artificial urinary sphincter is for men that are leaking much more, or maybe men that have had radiation in addition to their prostate being removed. This is a mechanical replacement for that sphincter muscle. So what we do is we place a small device that actually circles around the urethra that squeezes it and pinches it off. And whenever you want to urinate as a man, you press a small button that we hide under the skin in the bottom of the scrotum that releases that sphincter mechanism and allows you to empty your bladder, okay? Now, I think it's really helpful to look at an animation, especially of the artificial urinary sphincter, because this is probably one of our more complex devices. But again, it has a simple anatomic basis. It is a replacement for your body's natural sphincter. Again, it's completely invisible externally, but when you look internally, you can see the button, the sphincter, and the small little reservoir or tank where that saline lives. When you press that button, what happens is it removes saline from that cuff. Urine is allowed to pass through the urethra, and then it automatically turns back on and allows you to hold your urine. So you could walk up to a urinal at a ball game, at a movie theater, press the button, urinate in front of a whole row of guys, and nobody would ever know anything different. I don't know if anybody in here remembers when they used to have those trough urinals. They had those at ballparks whenever I was growing up. And truth is that you would never know if anybody had an artificial urinary sphincter, okay? So again, if you're leaking urine, you deserve to have that fixed, okay? You deserve to take control of your personal life and to get back that independence and that freedom that you deserve. No man should have to struggle with urinary leakage, okay? Now, whenever we talk about any surgery, like we mentioned with the penile implant, there are always associated risks. Luckily, those are relatively low and relatively uncommon. And again, I'm more than happy to discuss any of those with you in clinic whenever we're talking about what's going to be a good long-term treatment option for you, okay? Now, insurance coverage is fantastic with these, okay? Honestly, I have not found an insurance plan that does not cover these. That includes even options like, Medicaid, okay? Medicare, absolutely. Medicaid, even then. So again, insurance coverage, not an issue with either of these devices, okay? So in summary, stress urinary incontinence is a known side effect of prostate cancer treatment, okay? It can be an effect of some other neurologic conditions. It is not something that you have to live with, okay? We have a lot of really great treatment options for you. And we have urologists like myself who have dedicated themselves to this part of urology to give men that independence, that quality of life that they just so deeply deserve, okay? So I very much appreciate everybody joining us tonight. And now I really want to turn things over to our Q&A session.